A fever rises out of nowhere. The body starts shaking. The heart races. Somewhere inside the bloodstream, microscopic invaders are moving through the very system meant to keep every organ alive. Blood infections are frightening because once germs enter the blood, they are no longer trapped in one place. They can travel almost anywhere, reaching the lungs, brain, heart, kidneys, and the rest of the body in a matter of moments. But not every blood infection looks the same. Some begin with just a small number of microbes entering the bloodstream. Some stay temporary and are cleared quickly. Others spread, multiply, and trigger overwhelming inflammation that can spiral into organ failure. Medically, these conditions are often described with terms like bloodstream infection, bacteremia, fungemia, viremia, sepsis, and septic shock. Bacteremia means bacteria are present in the bloodstream, while sepsis is the body's life-threatening response to an infection. To understand how dangerous a blood infection can become, it helps to begin with the mildest and most limited forms first, then move step by step toward the most severe and life-threatening stages. Because once an infection reaches the blood, the real danger is not just the germ itself. It is how far it spreads, how fast it multiplies, and how violently the body reacts. Level 0. Transient bacteremia. The mildest form begins with transient bacteremia, which means bacteria enter the bloodstream for a short time and are often cleared before they can cause major harm. This may sound extreme, but according to medical references, transient bacteremia can happen even after everyday events such as vigorous toothbrushing or certain dental, gastrointestinal, or urinary procedures. In many healthy people, the immune system removes these bacteria quickly and no serious illness develops. What makes this level important is that it shows not every appearance of microbes in the bloodstream leads to disaster. The blood is normally sterile, so bacteria are not supposed to be there, but a brief invasion is not always enough to create a major infection. In a healthy person, white blood cells, immune proteins, and other defenses may destroy the bacteria before symptoms even begin. Some people at this stage have no symptoms at all. Others may have only a mild fever or brief chills. Still, even this lowest level matters because it can become more dangerous under the wrong conditions. If the bacteria are not cleared, or if the person has a weakened immune system, heart valve disease, an IV line, a catheter, or another source of infection, that short-lived bacteremia can progress into something much more serious. So level 0 is the smallest foothold a blood infection can get. Brief, limited, and sometimes harmless, but still the beginning of the story. Level 1. Sustained bacteremia. At the next level, the bacteria are no longer just passing through. They stay in the bloodstream. This is known as sustained bacteremia, and it usually means there is an active source somewhere in the body continually feeding bacteria into the blood. That source could be a lung infection, a urinary tract infection, an infected wound, an abscess, an infected catheter, or even an infection on a heart valve. At this point, the bloodstream is no longer experiencing a brief contamination. It is carrying a continuing infection. This is where blood infections become much more dangerous. Once bacteria remain in circulation, they can seed other organs and tissues. Medical references note that bacteremia can lead to metastatic infections, including serious conditions such as endocarditis, which is an infection involving the inner lining of the heart or its valves. That means the bloodstream is not just transporting bacteria, it is distributing them. Symptoms also become more noticeable here. A person may develop persistent fever, shaking chills, weakness, or a general sense of severe illness. Blood cultures are one of the key tools doctors use at this stage because if a bloodstream infection is suspected, clinicians usually take blood samples to identify the organism and guide treatment. NHS and MSD sources both note the importance of blood cultures when bloodstream infection is suspected, ideally before antibiotics when possible. Level 1 is the point where a blood infection has established itself. The microbes are not just entering the bloodstream, they are surviving in it, and the body now has a growing problem that usually needs urgent medical treatment. Level 2. Fungemia and other bloodstream infections. When people hear blood infection, they often imagine bacteria, but bacteria are not the only organisms that can invade the bloodstream. At this level, the infection becomes broader in type. Fungemia refers to fungi in the bloodstream, and viremia refers to viruses circulating in the blood. Medline Plus also notes that septicemia has been used for bloodstream infection caused by bacteria, viruses, or fungi. Though in modern clinical use, doctors often speak more precisely about bloodstream infection and sepsis. These non-bacterial bloodstream infections can be especially dangerous because they often occur in vulnerable patients. Fungal bloodstream infections, for example, are more likely in people who are already hospitalized, have central lines, have weakened immune systems, or are receiving intensive medical treatment. Once fungi enter the blood, they can be very difficult to clear and may spread to multiple organs. Viral infections can also circulate through the blood, though they behave differently from bacterial infections and are not all described the same way clinically. What makes level 2 more severe than simple bacteremia is that the bloodstream is now acting as a highway for different types of infectious agents, not just bacteria. The infection may be harder to detect, harder to treat, or more likely to affect already fragile patients. The danger also rises because symptoms can still look deceptively general at first. Fever, fatigue, chills, confusion, weakness, or low blood pressure. The blood may be carrying the infection, but the outward signs can resemble many other illnesses until the condition becomes severe. This level also shows why the phrase blood poisoning, though dramatic, can be misleading. The real danger is not poisoned blood. It is infection spreading through the circulation and setting the stage for the body's most dangerous response. Level 3. Septicemia. At this stage, the infection in the bloodstream is no longer just present. It is spreading in a way serious enough to be described as septicemia, a term often used in public language for a bloodstream infection that can rapidly become life-threatening. Cleveland Clinic describes septicemia as an infection that occurs when bacteria enter the bloodstream and spread, and notes that it can lead to sepsis, the body's reaction to the infection. Medline Plus also describes septicemia as a bloodstream infection caused by bacteria, viruses, or fungi, and emphasizes that it is serious and life-threatening. This is the level where the infection is no longer quiet or limited. The person may have high fever, chills, rapid breathing, rapid heart rate, weakness, confusion, or a severe decline in overall condition. The bloodstream is carrying microbes throughout the body, and the risk of widespread damage rises sharply. The infection may begin in one organ, but once it reaches this level, it becomes a whole-body threat. And this is also where the line between blood infection and the body's systemic response starts becoming blurred. Because once septicemia progresses far enough, the next stage is not just infection in the blood. It is sepsis, where the body's own immune response becomes so extreme that it begins injuring tissues and organs. That is where the danger becomes even greater. Level 4. Sepsis. At this level, the danger is no longer just that microbes are in the bloodstream. Now the body itself begins reacting in a way that becomes life-threatening. The CDC describes sepsis as the body's extreme response to an infection, and the modern clinical definition describes it as life-threatening organ dysfunction caused by a dysregulated host response to infection. In simple terms, the immune system's attempt to fight the infection starts damaging the body's own tissues and organs. This is the point where a blood infection becomes far more than a circulation problem. The infection may have started in the lungs, urinary tract, skin, gut, or bloodstream itself. But once sepsis begins, the whole body is involved. Symptoms can include fever or feeling very cold, fast breathing, a rapid heart rate, confusion, clammy skin, severe pain, and extreme weakness. Sepsis can progress rapidly, which is why health agencies treat it as a medical emergency. What makes level 4 so frightening is that the body's defense system is no longer acting in a controlled way. Blood flow can become abnormal, tissues may not get enough oxygen, and organs such as the kidneys, lungs, brain, and liver can begin to fail. This is the level where infection stops being local and becomes a full-body crisis. Level 5. Severe organ-spreading blood infection. Once a bloodstream infection reaches this stage, it is no longer just causing sepsis. It is now spreading damage into major organs or seeding entirely new infections in different parts of the body. In bacteremia, microbes can travel through the blood and establish infections elsewhere, including sites such as the heart valves in infective endocarditis. In fungal bloodstream infections like candidemia, the organism can also spread beyond the blood into the eyes, heart, brain, bones, or other organs. This is where the bloodstream becomes a delivery system for widespread infection. A patient may start with one source like a catheter infection, pneumonia, or a urinary infection. But once the microbes circulate long enough, they can seed new damage throughout the body. That makes treatment harder because doctors are no longer dealing with one infected location. They may be fighting multiple infected sites at once. This level is also where some bloodstream infections become especially deadly in vulnerable patients. The CDC notes that candidemia, a candida bloodstream infection, is associated with high rates of death. And during 2016 to 2021, about 1 in 3 patients with candidemia died while hospitalized. That gives a sense of how dangerous an invasive blood infection can become once it is established and spreading. Level 6, septic shock. At this level, the infection and the body's response have progressed so far that blood pressure drops dangerously, and vital organs are no longer getting the blood flow they need. NIH explains that in the worst cases of sepsis, blood pressure falls, the heart weakens, and the patient spirals towards septic shock. NHS Inform likewise notes that septic shock can lower blood pressure so much that blood does not reach major organs properly. This is one of the most dangerous stages any blood infection can reach. The skin may turn cold, pale, or clammy. Confusion can worsen. Breathing may become rapid and difficult. Urine output may drop as the kidneys begin failing. The body is now struggling to maintain circulation itself. What began as microbes in the bloodstream has triggered a collapse in the body's ability to keep organs alive. Septic shock is extreme because it is no longer only about infection or inflammation. It is about circulatory failure. Once this stage is reached, the risk of multiple organ failure and death rises sharply, and emergency treatment becomes critical. WHO states that sepsis can lead to septic shock, multiple organ failure, and death. Level 7, multi-organ failure blood infection. At this stage, the infection has pushed the body into systemic collapse. Blood pressure, inflammation, clotting problems, poor oxygen delivery, and direct infection together begin shutting down multiple organs at once. NIH explains that once sepsis and septic shock progress, organs such as the lungs, kidneys, and liver can quickly fail. Mayo Clinic also notes that as sepsis worsens, vital organs may not get the blood they need, and abnormal clotting can damage tissues. This is the point where a blood infection becomes a whole-body breakdown rather than a single disease process. A person may need intensive care, oxygen support or mechanical ventilation, intravenous fluids, medications to support blood pressure, and urgent antimicrobial treatment. Even when patients survive, recovery can be long and difficult because the body has been pushed through extreme physiological stress. NHS guidance notes that some survivors of sepsis experience long-term problems, sometimes called post-sepsis syndrome. What makes this level so severe is that the infection has now crossed every major boundary. It has moved through the blood, triggered an extreme immune response, damaged circulation, and impaired several organs at the same time. At this point, the bloodstream infection is no longer just spreading through the body, it is overwhelming it. Level 8, refractory septic shock. At this level, septic shock has become so severe that the body is no longer responding well even to aggressive treatment. Blood pressure remains dangerously low, circulation is failing, and vital organs are not getting the oxygen and nutrients they need. The National Institute of General Medical Sciences explains that in the worst cases of sepsis, blood pressure drops, the heart weakens, the patient spirals towards septic shock, and multiple organs can quickly fail. The World Health Organization also notes that sepsis can progress to septic shock, multiple organ failure, and death. This is the stage where the body begins losing the ability to recover its balance. The infection may still be present, but the crisis is now bigger than the microbe alone. Blood vessels are leaking, circulation is unstable, inflammation is overwhelming, and organs are shutting down under the strain. A patient at this level often requires intensive care, constant monitoring, intravenous medicines to support blood pressure, fluids, oxygen support, and urgent treatment of the infection itself. Even with all of that, the danger remains extreme. What makes level 8 so terrifying is that this is no longer simply a bad infection. It is a full-body collapse in motion. The bloodstream, which should sustain life, has become the route through which infection and inflammation have pushed the body towards systemic failure. Level 9, fatal blood infection. At the highest level, the infection has triggered irreversible damage. Multiple organs fail, circulation cannot be maintained, and the body can no longer recover. This is the deadliest possible endpoint of bloodstream infection, sepsis, and septic shock. The CDC states that without fast treatment, sepsis can quickly lead to tissue damage, organ failure, and death. WHO similarly states that sepsis can lead to septic shock, multiple organ failure, and death if not recognized and treated promptly. This final level is not defined by one specific germ. Bacteria can do it. Fungi can do it. In some cases, viruses and other pathogens can also be involved. What matters is that the infection has spread far enough, and the body's response has become severe enough. that survival is no longer possible. In Candida bloodstream infection, for example, the CDC notes that candidemia is associated with high rates of death, with about 1 in 3 hospitalized patients dying during 2016 to 2021. That statistic shows just how lethal bloodstream infections can become once they are established and invasive. This is the final level because there is nowhere beyond it. What began as a few microbes entering the blood has now become the complete failure of the systems that keep the body alive. The heart, lungs, kidneys, liver, and brain all depend on steady circulation and controlled immune function. Once infection destroys that balance completely, the bloodstream is no longer carrying life effectively. It is carrying the final consequences of uncontrolled infection. From brief bacteremia to fatal septic shock, every level of blood infection shows the same pattern becoming more dangerous. Microbes enter the circulation, spread through the body, trigger stronger systemic damage, and eventually overwhelm the organs meant to keep a person alive. That is what makes blood infection so dangerous. Once infection reaches the blood, the whole body is at risk. Thanks for watching.